If you eat a whole bunch of fat and cholesterol, your cholesterol doesn't change. However, if you just stop eating carbs or just stop eating altogether, it slams up. Okay, so I mean, this is not really what we've been told it was, and more people are understanding that dietary cholesterol really has nothing to do with your serum cholesterol. But fasting does. Not eating carbs does. So is fasting bad for us now? Is fasting causing heart disease? Is just not eating causing heart disease? Doubt it. In fact, most people recognize we have a lot of data on the fact that fasting, regular fasting, religious fasting has significant improvements in overall health. So we'll start with the first super chat here from Jack Margado. Thank you very much for that, Jack. Question, 51-year-old male, 3 months carnivore, 16-8 intermittent fasting. So it's this sort of split. He's only eating for 8 hours, fasting for 16. Sprint, heavy lifting, 5 days a week. Great. Sounds like you're on a good course. Would you advise TRT LDL too high? Question mark. Thanks from Brazil. So let me just take a look there. I don't think I'm used to normally using those units for free testosterone. So I don't know exactly where that how that's going to translate. But the thing with TRT is that it's purely individual. Like if you feel that you're not doing well, you don't have very good energy, that's sort of affecting you negatively, and you have significantly lowered testosterone, that's something you can think about. I would, you've been doing it for 3 months, that's great. I don't know when those blood tests were taken, but I would check them again probably in another 3 months because they go up. And I have a lot of patients that go on a carnivore diet and they double, even triple their testosterone as an older man, 60s, 70s. And so you're doing all the right things. So I would wait if you feel like you can wait. If you feel that you're really symptomatic and you really don't feel well, you can always talk to your doctor about that. Because I don't know exactly where those numbers line up, so I can't really give you a good estimation on that. But it really matters your symptoms and how you feel as well. So if you feel like you're doing good and you're improving, then I would just wait, and I would wait another 3 months, 6 months, keep doing what you're doing, check it again, and then see where you're at. And if you're feeling good, I don't think you ever really need to take it. It's just that if you feel that there's room for improvement that the diet isn't quite getting, then then you can think about that sort of thing. The LDL, I don't really worry too much about. I think it's a poor indicator for heart disease. You have very good HDL, you have very good triglycerides, which means you almost certainly have a pattern A LDL, which is the large point LDL molecules, which are the good ones. Even if you had pattern B, which are the bad ones, the damaged small dense LDL molecules, it still wouldn't be a massive increased risk. It's like 1.7 times increased risk of heart disease, whereas metabolic syndrome is 6 times increased risk, and diabetes is 10 times increased risk, which is up there with smoking. So the cholesterol really doesn't make as much of a difference as if you manage your metabolic issues. And it's the high blood sugar and the other nonsense that you're eating, the inflammatory sort of things that are damaging the LDL and creating the SDLDL in the first place. So you address one, you'll fix the other at the same time, and you are. So that's all great. And because cholesterol and LDL have been shown to just have been a scapegoat for the sugar companies trying to cast the blame away from sugar, why are we still considering this? It was never a problem in the first place. You just have to throw it out. And so in my head, at least I have, for the most part. I think you can look at it for some things. It's a marker of metabolic disease, right? If you have low HDL and high triglycerides, well, that's one check against you for metabolic syndrome. Okay, so that's important to look at if you're worried about metabolic syndrome. After that, I honestly think it's just been, the waters have been so muddied, you just really can't even look at it as a serious marker for cardiovascular disease. That's my personal opinion, but that's what I think the evidence shows. That's what evidence shows me. And So that's what I think about that. Again, with the testosterone, though, I go back to this a lot with blood tests. How you take the blood test. You're working out 5 days a week. Did you work out the day of or the day before you got your blood test? Did you get your blood test done first thing in the morning, fasted, at least 2 glasses of water, and no exercise or sexual activity the day of or the day before? It matters, and it really matters for your testosterone. It really matters. So you peak your testosterone production in the morning, and then throughout the day it's going to come down, but the action of that testosterone will continue on, and so you won't feel like you have low testosterone, but your serum levels will be low. And so if you check your testosterone in at 12 or in the afternoon or in the evening, it's going to be much, much, much lower than if you checked it first thing in the morning. If you worked out the day before or the morning of, you will have lower testosterone. If you have sex, you will have lower testosterone. That's just how this works. And then it balances out later on down the track. Long term, working out will raise your testosterone, but it can negatively affect a blood test at the time if you work out too closely. Same with cholesterol. It can change your cholesterol numbers as well. So you need to take your blood test first thing in the morning between 8 and 9 a.m., fasted from the night before 9 p.m., only water after that, and only water in the morning, no coffee or tea or medications or anything like that. It all makes a difference. And not even any supplements or anything, just water, just 2 glasses of 8 ounces of 2 8-ounce glasses of water at least. So same hydration status, and no more than 4 8-ounce glasses of water in the morning. Be very calm. Don't rage out and freak out and get angry at traffic or something like that on your way to the blood test. Just be very relaxed, very calm, very sedate, the morning of, the day before, and a couple of days leading up to it. And no exercise or sexual activity the day of or the day of or the day before you get your test done. It all matters. So keep that done, especially when you're talking about hormones like testosterone. You need to keep that consistent, or else you'll get inconsistent results. And like, oh, my testosterone went down. Why is that? Or it went up, and maybe it actually didn't go up. So you need to do these things in this meter fashion, or else you're not going to get consistent results. You have to have consistent test taking so you get consistent test results. And so that's what I would do. If you're feeling okay and you're feeling better, just keep going as you are, and check it again 3 to 6 months and just see how you feel. That's the important thing. I like getting people off medication. So I have patients that come into me in my functional medicine practice, outside of neurosurgery, and they're on TRT, and I get them going with this, and they're doing all the things that you're doing, and they're feeling so much better. They're like, hey, do I even need to be on TRT? I'm like, well, no, not if you don't feel you do. And they start coming off, and they're happily come off of this, and their testosterone stays up and stays good. So that's my preference, is to get people off medications when and where you can. If someone's very deficient, yes, doing these sorts of dietary measures and exercise will help them, will improve things, but it'll take time, and maybe they're feeling pretty rotten and miserable right then. So maybe you put them on a supplement or something to bring them back up to a better level, so that they feel better and healthier, and that affects a lot of other things as well. That's something you can do. But if you're already going and you already feel good, then I just keep going, and I just keep looking for improvements. Okay, good luck with that. Question from Rachel. Nice to see you, Rachel. Rachel is one of my Patreon members, so it's very nice to see you here. My first ever super chat. Glad it's for you. Oh, well, thank you very much. That's very sweet of you. Forever your student. My healing story. My first YouTube, why I became a carnivore out today. Carnivore family has become my family. God bless you. Well, that's very sweet. And so for people that don't know, Rachel just started her own YouTube channel, just talking about her story and why she came to carnivore and the effects that she's having and how that's been helping her. So people should check that out. You can click on her name. It's so Rachel Marion, MED, and you can check out her story. She's very, very sweet. And I've seen it, and I liked it. So very good job. When you start a YouTube channel, it's just like I did. It took me 4 years to just do it, and then I finally did it, and then it was easier, and so I just did another one and another one and another one, and you just talk about things that you find important, that you think needs to have a voice, and And you know, and then you just keep making videos about that, and then you sort of find your rhythm on the different things that you like talking about, and you just go from there. So good job. Question from Zillan. Thank you very much for the super chat. Hi, 1 month beef and water. Recently experienced diarrhea and would wake up late at night by stomach pain caused by diarrhea. Maybe I should reduce fat intake, but I work out a lot and still crave fatty meat. Any advice? Yeah, so if you're doing everything just beef and water, then and nothing else, no coffee, tea, caffeine, or any sort of like you know, pre-post workout supplements and things like that that may have artificial sweeteners, those can all cause diarrhea and loose stools and stomach pain and upset. So if you're having any of those, obviously stop those. Even protein powders, they'll have artificial sweeteners that aren't going to do well for you. But if you're not doing any of those, if it's only beef and water, then yeah, you know, you can pull back on the amount of fat that you're eating because you can only absorb so much fat. The other side of it is that if you're not having nearly enough fat, that you can actually get what's called overflow diarrhea, where you get partially obstructed, you get really constipated, you get really dry, hard, rocky stool that's sort of stuck there, and then there's only sort of liquid stools can pass around it. Okay, so that means you're really not eating enough. You're eating way too little fat. And so what that will look like is you'll get sort of watery diarrhea, and then every now and then you'll get this big, rocky, hard, very difficult to pass stool that comes out. And you're like, Jesus, where'd that come from? And then it'll be liquid again. Okay, so that would mean you're very constipated and you need a lot more fat. Okay, the other side of it is some people just have a harder time absorbing rendered fat, like if you have tallow that you're adding, or butter that you're adding, or just the melted fat that comes out onto the pan, and you put that back over the steak, which is good to do because you want that fat generally. Sometimes people have a problem or have a difficult time absorbing that. It just basically goes through them too quickly, and they just need to focus on the solid fat in the meat. That usually helps people in that situation. Another thing is sometimes in rarer occasions, people can't even really do the cooked fat all that much. They have to sort of eat it uncooked, right? And then they cook the steak, but they cut off the fat before it's cooked. And then, hey buddy, little visitor, little rat tail, and you know, so you'll have just the raw fat, and you cut that off and eat it uncooked, and then you cook the steak separately. And a lot of people do really well with that. There are some people that have a bit of problems after that, but you know, that was, I mean, literally a couple people I've ever seen still have issues after that. And then there's sort of things you can do past that, but that should sort out most people. It's generally getting a sort of the right balance. First thing is getting rid of all the things besides meat and water that can cause a problem, because most people at least have something still remaining. And then after that, it's adjusting the fat intake and the kind of fat that you're taking in as well. So I would do that, and hopefully that will sort you out. And a lot of people, you know, it's been a month, it's early days. So, you know, some people are just adjusting to the amount of fat, and sometimes their body starts making more bile and can absorb more fat down the track. And that's certainly pretty common. So I would just keep going with it, and those are some things that you can do to improve it. Question from NH. Thank you for the super chat. Hi from Germany. 3-month carnivore, down 30 kilograms. Wow, that's really great. Very good, a good job. I'm really happy to hear that. Not everyone gets those results right away like that. However, you did. So I'm very happy to see that, and good for you. I'm very pleased. All right. Let's see if we have other questions down here. Okay. No Insanity Renee, thank you for the super chat. Dr. Chaffee, did you dress up for JT's carnivore calendar? No, I'm just dressed up for work, so I'm just going straight into work after this. But I think there is a calendar thing coming out, and I was asked to do that, and I probably will. So we'll see. We'll see if I actually do that. But that's the idea anyway. All right, there is a super chat here from Annie M. Thank you very much for that. There's no question attached, but let me see if there's something sort of in the chat. If this happens, if sometimes the question doesn't get attached in, just try to put your question in as quickly as you can, so I can try and find it in the rest of the chat, because otherwise I don't see it, and I'm not seeing it. So okay, so sorry about that. Hopefully it might show up later. Miss E, thank you very much for the super chat. How to recover from pancreatitis while doing carnivore. I can't have eggs and dairy. Doctor says avoid fats and red meat. I'm only 2 weeks into carnivore. So pancreatitis is inflammation of your pancreas, and that can happen for a lot of different reasons. It does not come from eating carnivore. However, your pancreas makes all the different enzymes. It breaks down all your food, including carbohydrates and plants, and especially plants, because those are difficult to break down, but also meat. And so really the thing that you do with pancreatitis is you just sort of fast, and you just drink a lot of water. So I don't know where you are in that recovery, but people with acute pancreatitis that are in the hospital, you really just need to rest your pancreas. And so if I were to get pancreas for some reason, because you can get it for a lot of reasons, like a scorpion sting, you can get pancreatitis from that, it can damage your pancreas. You just sort of need to rest, you need to fast, and you need to sort of give it time, and you need to let your body heal a bit. Hey buddy, how you doing? And you need to let your body heal. So I would just, if you can, it depends on how skinny you are, it depends on how much you need from a nutrition standpoint. But if you're at all able to, I would just sort of limit what you're eating in general. I mean, if you're eating carbohydrates, your pancreas makes amylase as well, and that's what breaks down the carbohydrates. So I mean, really the only thing is like simple sugars you're going to absorb. Like glucose and high fructose corn syrup, you'll absorb those without any problem, because there's no bonds to break. And unless they're telling you to just sort of become a hummingbird and just drink sugar water, you still you should, if you're going to eat, I would still eat what you're supposed to eat, which is just meat. And if you are having trouble, I would just sort of limit it and try to just fast a bit if you can, until this sort of sorts itself out. That's I don't treat pancreatitis, but from medical school and so on, what I remember being the treatment is basically just you have to fast these people. They have to drink a ton of water, and when they're in a hospital setting, they just put them on tons of fluids, and you just let their body heal, and they've just got to rest and relax and let their pancreas heal, because the pancreas is involved in the digestion of everything, not just meat and fat. Yes, meat and fat, but also carbohydrates and everything else. So that's the skinny there, is you really just need to rest your pancreas, and that means fasting as much as you can, and then just small amounts of meat, which is completely bioavailable and very easy for your body to digest and absorb. It's much easier than plants. So, I mean, the only easiest thing is going to be the simple sugars, because you don't need any enzymes to absorb those. But those come with their own problems. But in a pinch, that's just so people know that is something you can absorb without enzymes. And there's also different enzymes that you can take. There's like creon and things like that. When people have pancreatic insufficiency, they can take those with the food that they're eating, and then their pancreas doesn't need to work because they've got these enzymes going. So that's another option too, that maybe you can talk to your doctor about as well. But you probably won't need it if you're home with pancreatitis and just recovering from it. That means that you're on the road to recovery. If you were in the hospital, it'd be a different story, and you'd really need to fast and all that sort of stuff. But if you're at home with this, then that's a different story. And so I would see how your body feels, and if you're just eat small amounts and ease into it, and have big rest periods between between meals, just to let your pancreas rest.
Hey everyone, I hope you're enjoying this replay of my YouTube Live. If you'd like to catch a live version and ask your own questions, please go to the next scheduled one, usually every Thursday at 6 p.m. Pacific Standard Time. All right, see you then, and please enjoy the rest of the Q&A.
Okay, question from Sama. Female, mid-40s, HDL 57, triglycerides 66, LDL 235. I think that's great, honestly. LDL particle number 2528, LDL pattern A. Perfect. There you go. So you see that good level of LDL, good level of triglycerides, and you get a pattern A. ApoB 153, normal range is 90 to 119. LP little a 68, you want under 75. High sensitivity CRP under 0.3, excellent. Just under 1 is fantastic. CAC score 59, HbA1c 5.2, insulin 5.4. Her diet doctor listed low carb, GP primary care, wants her to take Lipitor and aspirin. Why? Well, this is just always the way, I mean, they're saying now that anyone over 50 should just be on a statin, everyone, regardless of your cholesterol. I disagree with that. I mean, these are things coming from the statin companies, and they're saying that half of people over 40 should be on them, and then they're moving towards saying everyone over 40. Because why? Because they get to sell more drugs to people. This is a drug cartel. They're just doing it legally. I don't agree with it, and I don't think that you should take their word on their own product. I think that's really dumb. But if you look at their own research, their own studies, which is going to be the best light this is ever going to be painted in, if you have had a heart attack and you are taking statins after you've had a heart attack, and you take it every single day for at least 5 years, then you will, on average, extend your life by 5 days. That's their numbers. 5 days, okay? And you're getting side effects and problems from the statins that whole time, okay? This can cause serious problems, cause memory issues, potentially increase dementia. Your brain is made out of cholesterol. Lipitor, in some studies say it doesn't cross the blood-brain barrier, others say it does. And that stops your brain from making cholesterol. It doesn't just grab the cholesterol and pull it out of your system. It stops your body from making the pattern A large buoyant LDL molecules in the first place. So even if you had pattern B and you took a statin, it would actually lower the ones you want. And now you have a disproportionately high amount of the type that you don't want, right? So this can get into your brain and stop your brain from making cholesterol. Your brain needs cholesterol. About 20% of your brain is cholesterol. The cell membranes are cholesterol. The axons are myelinated and insulated with cholesterol and saturated fats. That's what increases the conductivity of your neurons and allows your brain to work. So you reduce the cholesterol in your brain doesn't work as well. And we are seeing that now. People having memory issues, people are having reversible cases of dementia or Alzheimer's because they're on a statin that crosses the blood-brain barrier. And then you take them off those statins, and all of a sudden they don't have Alzheimer's anymore in 6 weeks. And then you put them back on, and what do you know? In 6 weeks, they have Alzheimer's again. So that's scary. So these things do not come without risks and drawbacks. And so if you've had a heart attack, you'll increase your life by 5 days, but you could destroy your brain and a lot of other things. If you have not had a heart attack, it doesn't really increase your life at all. 5 days really doesn't increase your life at all. It's 5 days, okay? So you need to think about that as well. Your HDL is great. Your triglycerides are great. LDL is associated with longevity and living over 100. So is low insulin, which you have. So really, again, this is more to do with a metabolic issue. If you have pattern B, it's because you have high blood sugar and you're eating seed oils and sugar and alcohol and all these sorts of things. And that is damaging your LDL. It's also damaging everything else. And that's what's causing the problem. I think that the SD-LDL, the pattern B LDL, is the smoke, not the fire. I don't think that's causing the harm. because it's 1.7 times increased risk if you have SD-LDL. But diabetes is 10 times increased risk. Smoking is around 10 times increased risk. So that, if you have a strong association, then you start to think, well, maybe this is a causative factor. But if it's a weak association, well, why would it be a direct one-to-one cause? It should be a one-to-one association, but it's not. It's a very weak association. So to me, that doesn't scream cause. To me, that screams collateral damage. This is a marker, an indicator of something else going on, and this is being damaged at the same time. That's what that says to me. ApoB, that's sort of like taking your total cholesterol. There are a lot of different things in ApoB. Some are good, some may be bad, but you can't really tell just by checking ApoB. Dr. Paul Mason has a great video. It's very short. It's like it's a YouTube channel that sort of takes short clips from different videos, and you can look up Dr. Paul Mason ApoB, and it's sort of 5 minutes, and he explains this in very succinct detail. It's great, and so that will put your mind at rest. Lp(a), yours is in a good range. That's really genetic. You really don't really change that too much with diet and lifestyle. That's pretty genetic. If that's high and elevated, you just sort of have a genetic predisposition to developing atherosclerosis, maybe. But so what do? You correct all the metabolic issues. Saturated fat doesn't really come into it because this seems to be really mostly just genetic. You either have high Lp(a) or you don't. And your HSCRP, that's excellent, right? So having elevated high sensitivity CRP, that's just a marker of inflammation, general inflammation. And if this was just a one-to-one cholesterol causes heart disease, why are we worried about inflammation? Why are we worried about diabetes and high blood sugar if it's just to do with your cholesterol, right? So your inflammation is very low. So you don't have that risk as well. So all your risk factors are very low. Your HbA1c is normal. You don't have diabetes. Your insulin is low. You don't have insulin resistance. Your CAC score is 59, or her CAC score is 59. What was it last year, 2 years ago, 3 years ago, 4 years ago, right? When did she start carnivore? When did she, get these tests done? All these tests are just a snapshot in time. You don't know if things are going up, down, or what the change is. So you have to get subsequent tests. Also, CAC score just looks at the hard plaque and doesn't look at the soft plaque. So you could potentially have a lot of soft plaque and then that be coming down, but your CAC score goes up a bit because a bit of it gets calcified. Also, Lipitor increases your CAC score. It calcifies those plaques, and that's called a good thing. They say, yeah, this is really good. It stabilizes these plaques. Okay, but I thought you didn't want a high CAC score. But they're saying you do as long as you're taking their medication. So as long as it's their medication causing a high CAC score, that's good. So there's a lot of weird things going on with this. But by their own numbers, by the drug company's own numbers, which are as good as it's ever going to get, because they're going to paint this and develop and design their studies to be as good as they're ever going to be. 5 days. If you've had a heart attack, if you've not had a heart attack, doesn't really change anything. So I would address things metabolically. Those are much greater bang for your buck. And I honestly don't see anything wrong here. Your CAC score is mildly elevated. You really only get worried about it when it's over 100. But obviously 0 is nicer. But you've had a long life before today, and there could be a lot of things that contributed to that. And also, that doesn't tell you about your soft plaques either and what they're doing. Are they going up or down? So I would just, if it were me, I would just keep eating what we're designed to eat and allow my body to work the way it's designed to work. And in most cases, people improve, and that would be my bet with her as well. Aspirin has a lot of data behind it showing that the benefits to longevity. So I'm less concerned about something like that. The main concern I have with aspirin is just from a surgical perspective. We have someone come in, they hit their head, all of a sudden they have a big bleed, they need surgery, but they're on aspirin, so they might die in surgery from bleeding out. Sometimes you can't operate. Sometimes you do just to try, but maybe they're on like dual antiplatelets. That's just a non-starter. Aspirin is very difficult. I've seen people, very normal, simple operations die because they were on aspirin, because everything was perfect and fine and dry as hell, and then you close up, and then all of a sudden they're not waking up well, and something else is going on, and you do a scan, and head full of blood. So that's a danger. And if you have a bleed, or you have an injury, or you have stroke or something like that, and you're on aspirin, you get a minor bleed turning into a major bleed that needs surgery, that now can't get surgery because you're on the aspirin. So it's a bit of a catch-22 sometimes. And so that's that danger. But there is actually a lot of studies that and a lot of data showing the longevity benefits of aspirin. So if I'm not too concerned with that, but I take it on an individual basis. I don't take aspirin because I don't think I need aspirin, and I don't want the health risks and the bleeding risks that come along with it. But that one I'm a bit agnostic. That depends on the situation. Statins, I don't see that ever being a part of my life or my practice. I mean, there may be exceptions to that. I mean, people that increase their life by 5 days, I mean, this is on average, right? So there are people that extend it more than that. So there are going to be a cohort of people that this benefits. But people are thinking now that that's not to do with lowering the cholesterol, it's to do with its anti-inflammatory effect, that it has very mild. Aspirin's better, right? So that's why we take aspirin, because it's an anti-inflammatory, antiplatelet. And so that can have that sort of effect. And that's probably why it's helping. And that's probably why the statin is helping, because it has a mild anti-inflammatory effect as well. But a lot of people that are even proponents for statins say, yeah, it's probably not anything to do with the cholesterol. It's probably really just to do with the anti-inflammatory effect. Okay, take an anti-inflammatory then, and leave the statin at home. That's sort of my thought process. And I have cholesterol numbers similar to that. My HDL is higher. My triglycerides are lower. Like I have 3 times the amount of HDL as triglycerides, but my LDL is similar. And I have pattern A. And so I don't feel that I need a statin for my life, but of course everyone's individual. And so hopefully that gives a bit of information and insight so that she can make a more informed decision on whether she wants to take it or not. I have a video just called The Truth About Cholesterol and Heart Disease. And I just go through a lot of the study and the data and the history about how this was used as a scapegoat. And so maybe watching that and showing that to her can give her more information. Also, I did an interview with Dr. Asim Malhotra, who is an interventional cardiologist in the UK, and he wrote a book called A Statin-Free Life. And he is not really a big fan of these things. People want to take them, he'll give them to them, but he describes what I've described to you, this is what you get out of it. You get 5 days, or maybe no days, and it comes with these other risks. And if that's what you want, then sure, But so you can watch those and see what you think and go from there. And good luck with that. Orange Dragon, thank you very much for the super chat question. Asking for stepmom, I have hemochromatosis. Can I do carnivore since I can't have red meat? If so, how much can I eat and how often, since I have to stay on a very low iron diet? So the thing is that all of these things are sort of beholden to our biochemistry and our metabolism and how our body's working or not working properly based on what we're eating. So we don't know how all of these things actually end up panning out long term if you're eating what you're supposed to eat. What do I mean by that? I mean that you can have derangement in your body that we call a disease that just sort of clears up when your body eats a normal diet. So I don't have too much experience with hemochromatosis. However, Dr. Sean Baker does. He has a large, over 10,000, 12,000, 15,000 people in his referral system that they track numbers on, and they do have hemochromatosis patients. And he's found that actually going on a carnivore diet actually improves their numbers. So it could very well be that this is more to do with how your body metabolizes iron rather than how much iron you're getting in. Of course, that is the case, right? Because if you're eating a normal amount of iron and you're getting, a buildup in your iron that's far too high, your body's not processing iron properly, right? So if you get back onto a normal diet and you get away from these sorts of metabolic disruptions, could very well be that your body works properly. There are plenty of meats besides red meat. So you can definitely do a carnivore diet without red meat. at all. You don't have to have any red meat at all if you don't want to. So chicken, fish, pork, all the rest, seafood. And so if that's what you want to do, then go for it. See how you feel. See what your numbers are doing. See what's going on with that. But then you can always try the red meat. And if your numbers are improving, everything's getting better, and you go like, wow, okay, maybe this is something to do with how my body's processing iron, not just the amount of iron that's coming in. Then you can try the red meat and see how that affects you as well. And if that starts creeping up, you don't like that, then fine, you can stay away from red meat. You don't need red meat. There are a lot of other meats out there. But you may find that it actually improves things. Now, maybe it doesn't change anything at all. And maybe you eating red meat or white meat or seafood or bread and pasta, maybe your level's just staying up here no matter what you do. And that's like, well, then who the hell cares? Eat what's best for you apart from that, and then treat the hemochromatosis, which is usually with bloodletting. And with the doctor, obviously, not at home. And so that's what I would suggest is just, do some self-experiments, see how your body works and see how you feel. And if you can do red meat, great. And if not, then you don't need to. It's not required. Pound for pound beast. Thank you for the super chat. I've been carnivore since January 1st. Best feeling ever. Blood pressure down. Lost over 30 pounds. Blood work improved. That's awesome. I'm really glad to hear that. Triglycerides down, HDL 54, etc. But my LDL did go up. I feel amazing, but my practitioner is concerned. What's your input on that? Well, my input on that is we have studies looking at people. We give them 36 eggs a day for several weeks, and their cholesterol changes not one iota. But then you have studies showing that when people fast and just stop eating altogether, their LDL slams up, right? So why is that? Because you're now in a fat-burning, fat-mobilizing metabolism, and you need to mobilize fat. And that's what LDL is for. It's moving cholesterol and things like that around your body. And so that's what I think is going on. This is a transport molecule that is transporting fat and cholesterol, right? So when you're in a fat-burning metabolism, you're going to need more of this stuff. That's my view anyway. And if you eat a whole bunch of fat and cholesterol, your cholesterol doesn't change. However, if you just stop eating carbs or just stop eating altogether, it slams up. Okay, so I mean, again, this is not really what we've been told it was, and more people are understanding that dietary cholesterol really has nothing to do with your serum cholesterol. But fasting does. Not eating carbs does. So is fasting bad for us now? Is fasting causing heart disease? Is just not eating causing heart disease? Doubt it. In fact, most people recognize, we have a lot of data on the fact that fasting, regular fasting and religious fasting has significant improvements in overall health. And so what are we doing here? Again, why are we worrying about LDL? It was a scapegoat. It was blamed for something it never did. The Journal of the American Medical Association published in 2016 actual internal memos from the sugar companies detailing how they paid off 3 Harvard professors to falsify data and publish fraudulent studies to make it appear as if cholesterol caused heart disease, when there were studies coming out showing a strong correlation between sugar and heart disease. So they're like, okay, we need to get the focus off of sugar. One of those professors was named head of the USDA, and he was the one who authored and published the 1977 USDA declaration saying that cholesterol causes heart disease. Saturated fat increases cholesterol. Stop eating both. Well, that's wrong. That was a lie. It was a lie then. It's a lie now. And so that would be my input on this. Jesus Christ, you feel the best you've ever had. Your blood pressure's down, your blood sugar's down, your insulin's down, all your bloods are improving, your triglycerides are down, your HDL is up, you've lost 30 pounds, you feel amazing, and your doctor's going, stop it immediately. That's cognitive dissonance. You're seeing something in front of you working and being better, and I guarantee you that doctor has never seen that happen before. I guarantee you they have never seen that happen to that regard. Now, ask your doctor, if you just took LDL out of the equation and you just looked at everything else, looked at your overall health, looked at all your other blood work, what would you say? They'd probably say, well, that whatever you're doing, keep doing it because you're awesome, and you are improving dramatically, and they would be very happy for that. So if you don't consider that, you don't look at that, What does the overall picture look like? We get so fixated on that little number, and I just don't think that it warrants that amount of attention. I really don't. So that's what I would do. And again, watch the video, The Truth About Cholesterol and Heart Disease, that I do on YouTube here. I think that's one of my better, that is my best one on cholesterol. And then the interview with Dr. Asim Malhotra as well. That's that talks all about statins and things like that. And he is definitely of that opinion that this has been we've been completely misled, and we really need to rethink the whole cholesterol model of heart disease. Super chat from Peter Whedon. Thank you very much for that. There's no question attached, but I will try to scroll down and see if there's anything in the chat, maybe put down afterwards. Let's see. Okay, I'm not seeing anything. Sorry about that, Peter, if you had a question. If not, we'll just thank you very much for the super chat. It's very kind of you. Let's see how many more questions we have. Okay, guys, I think I have 1, 2, 3, 4, 5, 6, 7, 8 more super chats. Probably need to cut it there. And one more just came in. So maybe we'll maybe cap it there, because I don't want to not get to any of these. And if we have a bit more time, I'll go through some of the just general questions that are in the chat if I can. But I don't want to run out of time and not be able to answer all the super chats. So, question from Low Carb Low Drama. Thank you very much for the super chat. Do statins fix atherosclerosis? They stabilize calcification, meaning they increase CAC score. Isn't that bad? In theory, does it matter whether your score is 50 or 300 or 1,000? Heart attacks happen to people with CAC scores of 0. Thanks. Yeah, look, so a CAC score looking at the hard calcified plaque, but that doesn't say anything for your soft plaque. So you could have a lot of soft plaque. And yes, if you had a big soft plaque and that ruptured, that could clot off and you could have a heart attack or a stroke. And that's the idea of, oh, well, it calcifies it, so it hardens it, so it doesn't break as easily. Honestly, I don't know where that came from. I wonder. I've always wondered about that. Like, has that actually been shown, or is that a theory? Because the problem is that what if you guys pay attention to this stuff long enough, you'll find that a lot of things that are just thrown out there in medicine are supposition. And it's just like, oh, well, there's calcifying. Well, I bet that makes it more stable. Okay, well, maybe there's some evidence for that, and maybe that's based on that evidence. But a lot of times people just say, like, I bet it does. And they just run with it. And because somebody in an authoritative position that people respect a lot and has a lot of clout, they just go like, well, this guy said it, so that's it. And people repeat it and repeat it and repeat it, and then it's there. I mean, this is the idea of propaganda from Hitler and the Nazis. They say, you make the lie, make it big, and keep repeating it until everyone believes it. Okay, so maybe this was not a lie, but the repetition makes people think that it's true, right? And so it could have been just a best guess. A lot of things are best guess in medicine because we just don't have perfect data, because you can't run randomized controlled trials on humans long-term throughout their life. You just can't, right? Not in a rigorous way like you can with lab animals. You can keep, because this is perfect, you can keep them there their whole life. And you can't do that. It's not ethical or practical, because people live a long time, and you can't enslave them and just take them away from their families and just raise them as guinea pigs. You can't. We do that with guinea pigs so that we don't have to do that with people. But it's an incomplete model. It's not a good model. And actually, I was watching something yesterday about Dr. Baker talking about that. Some of the problems, the limitations with our research on fiber, is that a lot of these studies are done on mice. Well, they're designed to eat carbs and fiber and things like that. So they're like, okay, so it's good for them. Oh, look at that, it's good. It's just like, well, yeah, it was good for a mouse. Is that good for us though? Not necessarily. So as far as these things go with us, it's sometimes it's best guess. And you just sort of do the best you can. It's very well-meaning people trying to just give people some information, some guidelines, say, hey, maybe this is a good way to go. And then people start doing it, and then you start being able to see more population-wide statistics on that. Still pretty weak evidence, but at least it gives you some data, and then you can extrapolate more from that. And then everyone forgets that you needed to do it in the first place, because everyone just knows, oh yeah, everyone knows that this is the case. So I always take these things with a grain of salt. As far as do statins fix atherosclerosis, I don't think there's any evidence for that. It's increasing the CAC score, which a lot of people will say that's a direct indicator of your risk for heart disease. Whether it is or not, or if it's improving things temporarily while your soft plaques are depleting and your CAC score goes up temporarily and then that comes down, who knows? I mean, these things are transient sometimes. There's the flux, there's an ups and downs and things like that. So you don't know the directions and the flow. You don't know the end result of what's going to happen. So I also take that with a grain of salt. However, if you're eating a lot of bad things and smoking and drinking and eating crap and your CAC is going up and up and up, I would take that as a direct sign of danger. I don't know of any information that suggests that statins fix atherosclerosis. The idea is that they just stabilize the plaques, but they don't reverse them, if that makes sense. So, that, and again, we're saying that a CAC score is bad, but then we put you on a statin for that high CAC score, and then your CAC score goes up. And then that's justification for putting you on more statins. It's a bit backwards. It's circular logic. And so, no, I don't know of any information that even suggests that statins reverse atherosclerosis. And I don't think they don't make that either. I think the only actual interventional trial that has been shown to reverse atherosclerosis in humans was meditation, reducing stress, for meditating for 40 minutes a day, calming the hell down, reducing your cortisol, chilling out, taking some me time, and that actually reduced plaques. Okay, so there will be other things that reverse atherosclerosis, I am sure. I would bet that doing a very non-inflammatory diet, like a keto carnivore diet, and getting a lot of this garbage out of your system, stop smoking, stop drinking, stop eating seed oils, and all the rest, that your body can heal from these sorts of things. But we don't have studies on that. It's just that's what I've been seeing anecdotally. And so there are case reports that are going to be coming out, like Dr. Jamie Seaman, her husband, reversed his atherosclerosis by going on a keto carnivore diet. I think it's more keto, but very close to carnivore, both of them. And, reversing his atherosclerosis. He's a doctor as well. And so she was saying that they might post that as a case report. Great. So, there are things that will likely reverse this. Statins, I don't think at all. Okay, question from Super Chat from Ben Naaman. Thank you very much for that. 3 weeks carnivore somehow have improved in 2 weeks. Yeah, well, that's the thing. When you're eating a bunch of plants and fiber, roughly 90. Well, my estimation is around 90%, 95% of the plant itself is fiber, right? So that's its structural component. You can't break it down. You can't absorb it. You can't use it. It has to come out the other side, right? Exactly the opposite for fiber, or for when you're only eating meat. You will absorb, if you're eating meat and you're only eating meat and you're not eating it with fiber or a bunch of protease inhibitors and other sort of digestive disruptors and tannins and things like that block your body's ability to break down and absorb the meat that you're eating, you'll absorb roughly 98% of the meat that you're eating. If you get rid of the gristle and you're just eating just the soft meat and the soft fat, nearly 100%. And so you have very little waste coming out. And so that's why. If it's dry and hard, that is constipation. It's not the frequency, it's the consistency. So you go on the Bristol stool chart, BRISTOL, and that shows you if you're constipated or not. It just says nothing on there about, it has to be every day or 6 times a day. It's the consistency and the quality of the stool, not the frequency of your movements. So if it's every 2 weeks, but it's soft, you're fine. If it's every 2 weeks and it's hard, rocky, and difficult to pass, then that's not fine. You need to eat a lot more fat. So it's the fat that drives your digestion, not fiber. And in fact, fiber can block you up more, and because it's just more mass, it's more stuff to get stuck. But the fat keeps it soft, right? And it doesn't matter if it gets dry. Your colon is supposed to dry out your stools. That's its job. It's why we're fighting against our own biology. We have to move it through as fast as possible so this evil colon doesn't take all the water away. It's supposed to take the water away. It's not like, oh, it's just danger, time clock, go. No, it's doing its thing. It's supposed to dry this stuff out. If you have enough fat, it'll stay soft. So that's what I would do is just judge it that way. And if you're getting that overflow diarrhea, you're getting liquid stools, and then every now and then you're getting pebbly hard stools. That means you're really, really constipated. You have to eat a lot more fat, really ramp up the fat, and just see how you go. I did a thing on YouTube, just says you don't need fiber, and in parentheses fiber, constipation, and diet, and that goes through a lot of that in a bit more detail, so you can check that out as well. Jay Go Fast, thank you very much for the super chat. 42, carnivore, a little over 100 days, down 40 pounds. That's awesome. Very good job. My lab came back, 158 triglycerides still, HDL 44, sugar 98, LDL 450, CST score 0. Any reason why the high triglycerides? Well, again, these are a snapshot in time. You have to keep getting consistent results. Also, time of the day, fasting status, how long you've been fasting. The longer you're fasting, the higher those numbers go up, and so on. Your hydration status. Are you taking any medications? Did you exercise the day before, the day of, have sex, all these sorts of things? It all matters. It all changes everything. So if you take your cholesterol, multiple times throughout the day, you're going to get multiple answers. So just depending on what's going on during that day. So also stress. I have seen people that have had pattern B LDL, and they're just stressed out to hell. They're doing just meat and water, and they're trying to exercise, things like that, but they're just absolutely getting crushed at work or some sort of issues at home, and their triglycerides start creeping up, and their HDL starts creeping down. So all these things affect you. So make your life as good as it possibly can. Get the proper sleep, reduce stress as much as possible, exercise, so sprinting, lifting weights. Take your labs consistently, first thing in the morning, fasting from 9 p.m. So go back to where I was talking before about labs and how to do those. Do those exactly like that. I'll probably do a video, just a quick video on how you should take your labs that people can check out too, because it comes up a lot. And but your sugars are great. I bet your fasting insulin is great. The triglycerides and HDL, we're really just looking for signs of metabolic issue, like your sugars being too high and having diabetes or something like that, and that can be consistent with a pattern B type of cholesterol, right? So that's the main thing. I keep an eye on that from that perspective, right? So if your triglycerides aren't like massively high, and your HDL is in a good range, so that's good. So you likely have pattern A LDL, so that's good. So I don't think that's a bad thing. It will likely, when you keep going and you optimize things and you take tests in consistent manners, that should still improve as you go. Your HDL will come up, your triglycerides will go down, but that right there is actually still good, and you're doing great. You've lost 40 pounds, and I would hope that you're feeling really good on top of that as well. So that's a bit of a rundown on triglycerides, but that's not a bad number, and your HDL certainly isn't bad, and it will probably improve from there. But you already most likely have a pattern A LDL, and that's what we're looking for. Really, we're looking for signs of metabolic issue and the pattern of your LDL, which indicates that you're bringing something in your body or not, that's damaging or not, and causing metabolic function dysfunction or not. So that's where we go with that. So Eric Hinkle, thank you very much for the super chat. Let me see. There's no question attached. Let me see if there's something down the line. Okay, I'm not seeing anything, but thank you very much for the super chat. I appreciate it. Driving MIA, thank you for the super chat. Are supplements needed for low stomach acid? So I'm assuming you mean low acidity as in higher pH. Generally not. Generally, you just need to stay out of your own way. You need to stop taking medications that lower that, like PPIs or antacids and things like that. So definitely stop those. And then you just want to if you are worried about that your stomach acid isn't concentrated enough, this is when you avoid different like liquids and things like that, like water. Just don't drink much water 2 hours before a meal or during a meal or after a meal. Give it a wide berth on when you eat, and that'll keep your stomach acid very, very concentrated. And so that's usually what most people do. There are supplements that people can take if they actually have a problem with their stomach acid. I don't know how often that is, though. I would expect that to be exceedingly rare. And if you sort of get out of your own way and you stop eating, things that aren't great for you, and you stop taking all these medications and supplements and things like that can, like the antacids, that can disrupt that, almost everyone will be fine with that. So I would, and especially if you avoid water within 2 hours of eating, sort of before and after eating, if you're really worried about it. So I would try that. So see how you go. Try just not taking any of those things. Don't drink water, 2 hours before or after you eat, and see how you go. I would bet that you do fine, and that you digest things just perfectly well. Oh, sorry. Okay. People are adding in some more super chats here, guys. Please don't add any more super chats in, guys, because I've got to go in a couple minutes. I'm going to try to go through these pretty quickly. Dr. Chaffee, should I have portion control? I eat, as you said, nothing after 6. I confess once in a while I have an espresso with whipped cream and drink tea. I started to exercise 45 minutes a day. Well, that's great. You can eat after 6. Shuriken and I have spoken previously. I can't remember if I said to not eat after 6. Maybe there's a reason for that, but in general, people don't have to stop eating after 6. I mean, I eat right before bed often because it makes me tired and lethargic, and I just go right to sleep. And I like sort of being fresh and basically on an empty stomach the rest of the day because I have just better energy. Portion control. Your body normally gives you natural portion control when you're eating a natural diet, because it just stops tasting good. There are few people that will be an exception to this, but the vast majority of people will be able to eat fatty meat until it stops tasting good, and your body will naturally portion that out. And so you want to try to have leftovers. You want to make a bit more than you think you're going to want to eat, and then you get to the point where you go, I'd really rather stop right now. That's how you know you're giving your body what it needs. So in fact, you're trying to maximize what your body's taking in, right? You can force yourself after this, and it will taste bad, and you'll be really miserable, and you won't enjoy it, and it will take a long time. And yes, that's overeating. So you should have control in that sense, not to do that, not to push yourself past the point that your body is telling you directly, stop this right now. We don't want this. But that's pretty much it. And if you're drinking, coffee and tea, that can actually suppress your appetite a little bit. So I would still definitely try to get as much as your body's asking for and keep eating until fatty meat stops tasting good. Lady G Tarot, spiritual living that matters. Thank you very much for the super chat. There's no question attached. Let me see if there's anything below. Sometimes this happens, that the question doesn't attach, or maybe sort of hit send before the question is in there. So if that's the case, just try to put it in the normal chat. And okay, I'm not seeing it. Okay, well, maybe it'll show up later, but thank you very much for the super chat. I appreciate it. DC Donnie, thank you for the super chat. 28-year-old male, 5'11", 160 pounds, under 10% body fat. Great job. Never been over 175. Never been over 12% body fat. Awesome. Very athletic, eating over 2 pounds of red meat and drinking broth, butter, and still not gaining weight. How do I gain pounds for rugby? Our bodies are made differently, and we have, different sorts of maximums that our bodies are going to want to get to. But the main thing is you just need to stimulate your body to grow. Sprinting, I'm sure you're doing that in rugby, and lifting weights. You also need rest periods. So I've had, when I was playing rugby, I'd just be working out so much. During the season, I would lose 30, 40 pounds of muscle. I'd be very, very bulky, very strong, not fat or anything like that. Maybe it's, not, 6% body fat or something like that, but I wouldn't really be much more than 12 or 15, and I'd be much bigger. And then I drop 30, 40 pounds easily. It would be difficult to hold on to that during the season because you just go. And it's very hard to eat enough, and you don't get the rest days. And then all of a sudden we'd have a bye week, and I just would do nothing for a week, and just I'd be 10 pounds heavier at the end of it and leaner. So it's kind of crazy how that works. Your body builds muscle on the rest days, right? You need rest days. You don't want to overtax your body. You need to rest. You need to give your body what it needs. You need to stimulate your body first and foremost. You need to give your body the food and the amount of food that it needs to have the building blocks to grow, and you need to give it the rest days to grow. Okay, you can overtrain and you won't put on muscle. You actually slim down because you're not giving your body a chance to recover. So that's what I would do. You're already running, you're already sprinting, great. Lift weights like a champion, eat a hell of a lot of meat, and give your body rest days. You're going to need to eat fatty meat until it stops tasting good. So over 2 pounds is great if that's getting you to the point where you just have to put the fork down and go, I don't want to eat this anymore. And you do that twice a day if you're working out hard, because you're going to need a lot more than somebody else would who's not working out as hard as you are. And when I'm working out and I'm pushing myself, my body doubles the amount of meat that it asks for. So that's what you have to work for. So you're going to need to work in meals if your body's asking for that. I was talking to Ryan Talbot, who's the NCAA Division I All-American, 2-time All-American in the decathlon. He switched to carnivore halfway through his season. His season took off. He was an All-American that year, won the Big Ten championship. Next year got second in the Big Ten and All-American honors again. And he's down at the Pan Am Games now, competing in Chile, which is awesome. So, this guy is going to be in the running for the Olympics, right? He's up there anyway. And, he was losing weight, and it's just okay, what the hell do I do? It's you need to figure out where you can get food in, because you need enough food. You need to get these meals in, and you have to do it at a time that you're still able to train on an empty stomach and have enough, and then eat straight afterwards, and then give it enough time before your afternoon training and things like that. So you just have to sort of figure that out when you're going to get food in. You need to get enough food in. And then he had the opposite problem. He said he had to actually pull back on his workouts because he was putting on too much muscle. It was he was getting too big, too muscular, and he's like, hey, I need to keep my weight down so I can jump higher and run faster, right? So good problem to have. Most people have the opposite, like you're having here. So that's the main one. You're eating the right thing. You're working out properly. Well, I'm assuming you are. And, now you just need to get enough food in. And I think that'll take care of that. After that, our bodies do have a maximum that they're willing to get up to naturally. I wouldn't suggest doing this unnaturally because it has a lot of health ramifications long-term, and you don't need it. You can get extremely strong, extremely muscular, and extremely athletic by doing this naturally with, just those 3 simple things. Work your ass off, eat a lot of meat and enough meat so your body has what it needs to regrow, and give your body rest days. You'll have very good results with that. I think was it Mike Metzger or something like that. He was one of those big time bodybuilders back in Arnold's day. Guy worked out 3-4 days a week, and he worked out for 20-30 minutes. He did one set to failure. It was just you need rest days. You work out, you stimulate it, and then you rest. That's where the benefits come from. So you can definitely overtrain, and that will hurt your results instead of giving you more. So more is not always better. Damian Williams, thank you for the super chat. Awesome content. Your video discussing the deficiencies in cats eating cooked meat bothered me. I only eat well-done meat while consuming 4 raw eggs, egg yolks 3 times a week help avoid deficiency. Well, certainly you're going to get a lot of nutrients from that. Make sure you know where you're getting your eggs from so they're not like contaminated or salmonella or anything like that. I eat raw eggs sometimes too, but that's a risk. So do that at your own risk. So well-done meat for cats is a no-go. It's not going to give them the taurine and other sorts of nutrients that are essential to them that they have to have, that you lose when you cook the meat. We don't need taurine to the extent that cats do. We make it. Maybe some people need more or less. Maybe it's beneficial if you get more. Could be, but it's not strictly essential. But conditionally, it could be essential if you don't make enough or you need more for different demands. Same thing with carnitine. People say, oh, that's not essential. Bullshit. Only 70% of people make enough carnitine to make it not essential. 30% of people need to have some in their diet. It only comes from meat. So that could be the case with taurine as well. I'm not too sure. And there could be other ones as well. The difference between us and cats is that we have been cooking meat for at least 800,000 years. We're probably using ovens for 800,000 years. So, or that sort of oven technology. And that's a long time. So whatever happens to meat when we cook it, we're well adapted to that at this point. We're probably cooking meat longer than that, actually. So Homo sapiens came around earliest 300,000 years ago. And so we've been cooking meat for at least 500,000 years before Homo sapiens even existed, right? So Homo sapiens were developed from people that were already cooking meat. So we should be very well adapted to cooking meat. So I don't get too worried about that. There are people that eat a lot of well-done meat. I prefer it more rare, more raw. That just tastes better to me. I don't eat liver often. It's very rare. But also I eat it very rare. If it's cooked, it doesn't taste good. It's bad consistency. I actually just got some liver yesterday, and I sort of was cutting it up, and I was going to just sear it very, very lightly, just sear each side and keep it raw in the middle. And I just sort of had some raw. I'm like, that just tastes good on its own. Raw liver tastes way better than cooked liver, to me. I'm sure there's a lot of people that are vomiting next to their computers right now, but that's how that tastes to me. So having some raw egg yolks, probably fine, or even just lightly cooked, soft boiled or just lightly fried where the yolk is still pretty rare. That's probably fine too. But I don't get too worried about the well done meat. If you're feeling good and you're doing fine, I think you'll probably be okay. If you want to add in some raw egg yolks, I don't think that'll hurt you anyway, as long as it doesn't have any sort of contamination. So in any case, good luck with that. Bowl of Carnivore, good to see you, buddy. You're looking great. You're doing God's work. Well, thank you, man. I appreciate that. SN, thank you for the super chat. I have chest pain for more than 24 hours now. Ate only meat, tea, butter, and cheese. Went to ER, EKG, X-ray, BMP. Everything was normal. What do you think this might be? Well, there's a lot of different causes of chest pain. If it's sort of a sharp, piercing pain, it's worse when you breathe in or you push on it. That's going to be musculoskeletal. It's going to be in the rib cage as well. So you did the right thing. You went in, you say, "Oh, could this be my heart?" Yes, it very well could be. So you go in, you get it checked out. That's the most important thing. And then they investigate and say, is this cardiac-related chest pain, or maybe a pleurisy, is this a lung issue? You have a pneumonia or something like that that's causing chest pain, and they've ruled those out. So likely this is more musculoskeletal or something else. You can get some of this precordial syndrome, I think it's called, where you get sort of stabbing laser pain, it's just this weird stabbing pain. Generally, sharp pains aren't, like a heart attack sort of thing. You can have sharp pain towards your back. It's like this tearing, burning, or ripping, stabbing pain. That can be like a tear in the aorta. or in the lower aorta if it's in the lower back. And that's just a good rule of thumb for anyone to know. People over the age of 65 with acute onset severe back pain that's just new, just bang out of nowhere, that's a bleed until proven otherwise. Okay, so you just go get that checked out, especially if you're on blood thinners or anything like that, like aspirin or warfarin or any of the NOACs and things like that, like rivaroxaban and xarelto, things like that. Just good to know, but there are a lot of things that can cause chest pain. The important thing is you get it checked out and make sure it's nothing serious. Meat's not going to cause that. Meat's not going to cause any sort of cardiac pain or chest pain or damage to your heart that I know of. And so it's not going to cause heart disease either from what I can see. So I wouldn't be too concerned about that. If your doctors have checked this out and they don't think that it's not cardiac related or chest related, then it's probably just that muscular pain, musculoskeletal pain. And good luck with that. If it gets worse or it changes character, or you get shortness of breath with it or something like that, or it just keeps persisting, it's fair to get it checked out again. And if you're concerned about it, I would definitely get it checked out again. Sometimes people check something and it's early on, it's just not picking up, and then it's something, but something's developing. It's just too early for the tests to show it, and it becomes worse and gets better. If it gets worse, if you're worried about it, if it's persisting and you're worried about it, definitely get it checked out again. That's important to do, and it hopefully is just nothing, even then, but always important to check. But it's not the meat causing it anyway. Sales Spirit 99, thank you for the super chat. Can keto carnivore cause ketoacidosis? Also, what meat foods for 9 to 12 month voyage without refrigeration? No, it does not cause ketoacidosis. A nutritional ketosis is a metabolic state. Ketoacidosis is a severe medical emergency, and it has to do when you have zero insulin. And you have such high ketones that you become acidotic, and so you have acidosis with massively high ketones. So that you have to have both. So that's a medical condition that just shares that same root of keto, not the same thing. So no, you don't have to do that. Foods for a 9-month voyage. Well, think about the Vikings, right? They had barrels full of salted meat, and that's what they sailed all over the world. They made it to America, right? In I think the 1100s or something like that, or maybe the 11th century. I'm not sure. I think Leif Erikson is believed to have gone to North America, Northern Canada, maybe even Northeastern America. So that's what they had. They had salted meat packed in barrels and a buttload of water, right? 9 months of water. That's a lot of water. But that's what they did. You could also make pemmican. So you grind up, there's a lot of recipes online, you can look those up, but you grind up dried meat and blend it up really fine, add in rendered fat. About 3/4 of a pound is about 2,000 calories, right? So 10 pounds of pemmican is 10 days at 2,000 calories a day. So you can sort of calculate out what you think you're going to need. You can also fish, right? If you're on a boat voyage, if you're on a land voyage, you'll probably be able to restock somewhere. But that's what I would do. I would use pemmican, dried meats, salted meats, things like that, cured meats. That's what they're there for. They're there to you slaughter a pig or an animal, and you don't have refrigerators, so you need to dry it and cure it and prepare it so that can stick there in your larder for years, and you have food and don't die. Lori Olson, thank you for the super chat, saying GBM, yes, Thomas Seyfried protocol, is cachexia a concern? GBM is glioblastoma multiforme. That's a very severe form of primary brain cancer. Thomas Seyfried's protocol, for people that don't know, he's one of the top cancer researchers in the world. He's over at Boston College, and he has over 150 peer-reviewed papers in the literature. And he's a very, very good man. I think he's doing amazing work, and he truly cares about this. And he's not just trying to make a name for himself. He has a name. He really is trying to help people. And so people should watch that interview that I've done with him, with Professor Seyfried. It's excellent. It's one of my favorite ones that I've done. One of my favorite conversations. I've had a lot of amazing conversations. That one I was very, very, very excited to do because I really look up to him. Is cachexia a concern? Cachexia is when you lose so much weight, you just look very, very gaunt, like a cancer patient. Yes, that is a concern. You need to keep your GKIs, your glucose ketone index, down below 2 or below 1, if at all possible, for as long as possible. With a combination of keto, carnivore. Carnivore is keto, should be keto, especially in this case. You really need your ketones up and your glucose down. And that gets your GKI, glucose ketone index. So you do have a combination of your diet and fasting if you need to, because fasting can really bring that GKI down. It brings your ketones up and your blood sugar stays at a low, nice level. So if you are limiting the amount you're eating and you're even fasting for a number of days, yes, too much weight loss is a concern. And so you need to refeed on these other days. So the other days that you are eating, you need to get enough. And so maybe your GKI sort of comes up a bit. Okay, well, we're looking at averages over time. And so for that day, you refeed and maybe your GKI goes up a bit. I mean, your blood sugar will come up maybe a bit with a big bolus of protein. And maybe your ketones will come down a bit, but it shouldn't really go crazy. And so see how it affects you. If you're keeping your GKI down, you may not need to fast. You may not need to limit the amount of meat that you're eating. If you do find that sort of comes up when you eat and you need to fast, you need to limit the amount of meat that you're eating on certain days, you need to refeed on other days. So you need to make sure you're getting enough food on the days that you can on certain days, so that you can weather the limitation of food on the other days. So that's the idea, and that's a very important question. And I wish you all the best with that, or if it's a loved one who's dealing with that, or if it's just a general question. And for people that are in that situation, that's important to know about. So I will end with just one more question, then I really got to run, guys. Ryan Parrish, why does Paul Saladino believe there's adverse long-term effects to ketosis? Does long-term ketosis really lower testosterone? I have not seen that. It certainly hasn't happened for me or any of my patients. I've been doing this for 6 years. I've not eaten carbohydrates except for the odd glass of milk once every year or two. And my testosterone is great. I'll be doing a video when I find the time, going through my blood work. I've just had my blood work done. It's about a 6-year mark, and everything's great. So not too worried about that. Long-term effects of ketosis. I've looked at a lot of the literature, and I've seen studies with people that are looking at people in ketosis for 2 years, for 24 months, and they did not see their cortisol going up. They did not see different issues and metabolic issues and problems. They found that everything was actually great, and they improved. So I did a video with a friend of mine, Richard Smith, who goes by Keto Pro on online. And we talked about, is ketosis harmful? Is ketosis bad for you? And we go through a lot of the literature. And, we went through some of Mercola's interview with Georgi Dinkoff, who's a really nice guy. And we had a bit of a debate on this subject. And so people can look at that as well. That's not on my channel. That's on Brian Grin's channel, Gryn, I believe. If I've got that wrong, I'm sorry. And people would take a look at that as well. And we just had a very friendly conversation about it. Paul and I had a very friendly conversation about it on his channel. It was a bit of an issue with our Wi-Fi. It was hard to connect, so it wasn't as free of a back and forth. But I think we both got to say a lot of what we wanted to talk about. But Richard and I, it's like 2 hours where we go into the literature on this. I don't think that it's bad. I believe that this is not our fasting metabolism. This is not an alternate metabolic state. I think this is our primary metabolic state. This is the primary metabolic state of really most animals in the wild, carnivores and herbivores, because they all run on fat and protein. Carnivores because they eat animals with fat and protein, get some glycogen in the muscles. And if that's doing it, if that's doing the trick, it's fine. You're still getting what you need from eating just meat. Whether you're in ketosis all the time or not, I don't know. I don't really care. All I know is that we are we've been eating meat for a very long time. And I think that that's how we're optimized, and we're metabolically optimized that way as well. And so, other animals are doing that as well. The Inuit, they're eating meat. Maybe there's some glycogen in that. Maybe that kicks them out of ketosis. Maybe. I don't know. But they're just eating meat. And that's the main thing. I don't think that you have to eat anything else. I don't think you have to eat plant-based carbohydrates, right? So that's not, that's certainly not to say that we're in ketosis all the time, but we're certainly eating a ketogenic diet all the time, right? Like just meat anyway. We're not eating any plant carbs or sugars. And, lions are in the same state. They're just eating meat, right? Also herbivores, though, because that's actually what they break down fiber into. They don't get carbs from fiber and plants. They break the fiber down into fat and protein, because it's actually the bacteria that eat the fiber, and they secrete fat, which the cow or the gorilla absorbs, and then the bacteria die off, and they absorb that as protein. So they get fat and protein from eating carbs. So they don't get carbs. So they're all in this ketogenic fasting starvation state. I don't think it's a starvation state. I think that's our primary metabolic state. And whether we or not we go in and out of that, I'm not too worried about. I just think you eat what you're supposed to eat, and your body's going to work the way it's supposed to work, whether that's in and out of ketosis, 24, 20 hours a day. I don't know. 24 hours a day. I don't know. But I think that it's very clear that we've been designed to eat meat. And I, if we're in an ice age, if we're crossing a land bridge across the Bering Strait, in the last ice age, there's no plants and carbs to eat. There's just marine animals and marine life to eat. And so, if you had to do that, if long-term ketosis was harmful, like you'd die out, or you'd get used to it, which is what, I think we are. And carnivores in general are always in this state. So I don't know why that would not apply to us when it applies to all of them. Dolphins don't need a selection of tropical fruits every now and then. Neither do lions. So I don't think we do either. And that's just my 2 cents on that. But I'd go into much more detail with my friend Richard on that episode of is ketosis bad for you? So okay, everyone, I stayed a bit longer than I meant to. Thank you all very much. And thank you all. I have to stop there, but thank you all. I really appreciate you all coming on to this. I'm going to try to keep doing these at the same time every week. I'm not going to have like the 3 hours all the time, but I can certainly try to do as much as I can before work. So thank you all very much. I appreciate it. I'll have another. Actually, I have an announcement as well on Sunday. This coming Sunday, I'll be putting out my episode with Dr. Casey Means. She's a Stanford-trained doctor who was going into ENT and then decided that, look, everything's metabolic. We need to treat metabolic diseases. And so she changed her practice to treating metabolic disease, similar to what I'm doing now. And she started a company called Levels, which, you have constant glucose monitors and things like that. People can check that out. We'll have a discount for people who want to try that. We'll have like a discount for a week after we post that. That'll be on Sunday. And she's a very interesting lady, very knowledgeable in the subject, and describing exactly what we're all talking about here, which is like we have this plague of a metabolic disease. So that will be coming up this Sunday at 4 p.m. Pacific Standard Time, 7 p.m. East Coast time in the U.S., 7 a.m. in Perth, and 9 a.m. in Sydney, middle of the damn night in Europe. So I'm very sorry for that, but that's sort of the best time. And so people can check that out. Please come for the premiere and check that out. That's going to be a very good episode. And the more people in the premiere commenting, liking, sharing, the better it's going to do, and the better it's going to hit with the algorithm, and it's going to be suggested to more and more people. So thank you all very, very much, and I look forward to seeing you next time.
The problem is that with the tobacco companies, for decades they lied, said, oh, there's no evidence of that. Look at all these studies. Oh, look at these nice studies. All studies that they paid for. And these studies say all great things. Well, these studies say that you're full of it. Well, but we just got these studies. There's conflicting evidence. Who knows what's going on?